All right, 3-4 is the last section in the cancer unit. So we looked at what causes cancer, how do we diagnose it, how do we treat it a little bit, how do we prevent it, and now we're going to look at some new upcoming treatments for cancer. And this also applies, some of these apply to a lot of other things other than just cancer. So the first one we're going to look at here is pharmacogenetics. So it's a big fancy word, basically pharmacy or drugs, and then also how your genetic makeup looks in there. So these are the things you're going to do. You're going to have to recognize that all drugs do not act the same way for all individuals, and you should probably already kind of know that. Some people will take certain drugs and they'll work really well, whereas others they'll either get severe side effects or the drug just won't work very well for them. So you're going to you're going to protect, you're going to figure out why, and that's basically where the rest of these objectives come in, is why do these occur? So we're going to go back to those SMPs that we talked about in the bitter taste gene. SMPs, remember, are one's base pair difference in a nucleotide, so one nucleotide being replaced by another. So basically, just a single base mutation is an SMP. And then pharmacogenetics is the study of those SMPs and how they respond to drugs. So we're gonna you are working you're a a pediatric oncologist. You basically study cancer in children, and you're gonna be hit a lot with acute lymphoblastic leukemia. This is the most common cancer in children, and it's cancer of the bone marrow, which causes immature white blood cells. So the white blood cells do not mature fully, and they are then exposed to even more infections and more problems, and they could die from either the cancer or from various other diseases that they pick up that they can't fight off. So what you are going to be is you have four little girls, and they all have all or acute lymphoblastic leukemia, and they all have the same treatment, azathioprine, and that's a chemotherapy drug. And what we find is with all chemotherapy, some people respond very well to chemotherapy, some people do not. And it, so with this drug, Renee, is one of your patients, is feeling terrific. Her white blood cell counts have increased, and she is improving dramatically. She's feeling good. All her diagnostic tests are coming up back much better. We're seeing much improvement. Sue and Jada, they're feeling somewhat better. We're seeing a little bit of improvement, but we're not quite sure how much. We're going to have to do some additional tests and see if there's any other drugs that we need to use or any other treatments to go along with them. Maggie is feeling horrible. She has severe side effects, and her condition is becoming worse and worse and worse. So we're probably going to be looking to take her off this drug almost immediately because of how bad she is reacting to it. So what you're going to have to figure out is why do these four girls, or two, Sue and Jada pretty much react the same, but of the four of them, why do they react so much differently to this drug? So you're going to be doing that, determine how SNPs and haplotypes are related to this, and then diagnose a fifth patient called Nell, based off of what you've learned, diagnosing based off, and basically figure out if Nell would be respond to this drug, based off of what you learned about from Maggie, Renee, Sue, and Jada.